It is a birth story episode, and this one is a special one. Welcome to the All About Pregnancy and Birth podcast. I'm your host, Dr. Nicole Calloway Rankins, a board-certified OBGYN physician, certified integrative health coach, and creator of the Birth Preparation Course, an online childbirth education class that will leave you feeling knowledgeable, prepared, confident, and empowered going into your birth. Quick note, this podcast is for educational purposes only, and it's not a substitute for medical advice. See the full disclaimer at ncrcoaching.com/disclaimer. Hello, and welcome to another episode of the podcast. This is episode number 52. Thank you so much for being here today. Now, today's episode of the podcast is a birth story episode, and if you've been listening to the podcast for a while, you know that birth stories are some of my very favorite episodes, and today's birth story episode is no exception. Today's episode is actually even a bit more special because it's a birth story from one of the members of my signature online childbirth education class, the Birth Preparation Course. Miranda comes on to share her story, and Miranda is an emergency veterinarian who lives in New York. And at the time that we recorded this, her baby was just 11 weeks old. Miranda and I talk about all of the resources she used to get ready for her birth, including, of course, the Birth Preparation Course. We talk about her birth and how hard and scary it was at times. We also discuss what really helped her to get through it and how ultimately she feels great about her birth experience, and she felt like it was really an enormous achievement for her. Now, before we get to the episode, I gotta be honest. I was actually a little bit nervous having Miranda come on because although her birth was ultimately satisfying, it was not like she imagined it was going to be, and she definitely had some challenges during her birth. And as silly as this sounds, I was worried that you would somehow interpret her challenges as like a negative reflection on my course. I know that sounds silly, but that's kind of what I was thinking. But I had to remind myself of something that I say all the time to you, and that is that no one can plan birth, and no childbirth education course is going to guarantee a specific outcome for a birth because birth is an unpredictable process. However, a comprehensive childbirth education course can definitely help you be prepared to really weather that unpredictability and manage it well. And the birth preparation course did that for Miranda. She actually emailed me after our interview to say that she hopes she was complimentary enough in the interview, and she hopes that she made it clear that she thinks I'm really gifted at explaining things clearly and that I'm very kind and compassionate in how I deliver information. Well, thank you for that, Miranda, and thank you again for coming on and sharing your story and experience. So, without further ado, let's get to Miranda Hilliard's birth story. Thank you so much, Miranda, for agreeing to be on the podcast. I'm super excited to have you here and share your story.
Great. It's my pleasure.
Yeah. So why don't you start off by telling us a bit about yourself and your family?
I am a veterinarian. I work in emergency veterinary medicine, and I live in New York City with my husband. I'm from Massachusetts originally. My husband is a New Yorker through and through. And he works in healthcare research. We've been married got married last summer.
You're newlyweds.
So we are newlyweds. We've been together longer than that, but recently married. And we live in a small apartment with our dog and now with our 11-week-old daughter.
Awesome. So let's go ahead and talk about, I know we'll get to what your birth was like and how, you went through the birth preparation course and getting ready for your birth. But first, let's just give a little bit of background of what was your prenatal care like?
So we gave birth at one of the large hospitals here in Manhattan, and our prenatal care was at that hospital with a doctor's group, the OB doctor practice at the hospital. I am advanced maternal age. I was 39 when we got pregnant. I was 40 when we delivered. And so I had pretty frequent visits throughout the pregnancy, also had pretty frequent ultrasound scans. But for the most part, my pregnancy was complication-free.
Okay. Do you feel like you were supported during your prenatal care, that you got information that you were looking for?
I definitely feel that way. We chose our doctor. He was the doctor who did the prenatal care for my sister-in-law, and she was really happy. That's, I'm sure, for many people, personal recommendation meant a lot to us. And I felt very well supported, and I felt that he explained, we went through the blood genetic testing initially and all the steps. Always felt like it was very well explained why we were making certain choices.
Awesome. That's good to know. It makes me feel good when I hear that people are happy with the care they receive.
I think also because I'm a veterinarian and therefore had medical training, my OB thought that was really fun. And so, he loved to talk about how things are different in people compared to animals giving birth. So that was really fun.
And as veterinarians, you have to know like a lot more. We know like one body system. You have to know like many body systems.
Fair. But I mostly just do dogs and cats. So it's not, I no longer do all of them.
Got it. All right. So when you were thinking about, heading towards your birth, were there some specific things that you wanted for your experience?
So there definitely were. It really meant a lot to me. I really wanted to have a vaginal delivery. I know, of course, that C-section saves babies' lives, saves women's lives, and that women who have C-sections recover, and it can be a beautiful birth experience. But that was something that was important to me.
Sure.
I also got really excited about the idea of avoiding having an epidural for my birth. I got there. I had read that when women don't have epidural, they have a shorter recovery period. And I liked the idea of being able to move around during the pushing stage. And it just seemed to make sense to me. I think it definitely became a bit of a like believing I could do it thing. So going into it, that was another thing that was important to me. And then the other things like delayed cord clamping and immediate skin to skin were all standard of care at the hospital I was delivering at. So it wasn't, I didn't really have to advocate strongly for those things.
That's good. I'm glad to hear that. That is a fairly recent thing. I think that it's standard of care in most hospitals. So that's great that you didn't even have to really think about that.
Exactly.
Yeah. So when you were getting ready for your birth, what kind of resources did you look into or use? And I know you used I know you used the birth preparation course, but certainly I'd love to hear what other resources you considered or thought about and ended up using.
I'm definitely a analytical and data driven person, so I think I overdid it. I bought a lot of books.
Right.
So my husband and I did the childbirth prep course offered at the hospital together. And it actually was a childbirth educator who had, no association with the hospital. She was a really excellent educator. We chose for scheduling to do the 1-day, 8-hour session. And that was really great. I think he especially benefited a lot from it. It was a lot of information that I had already known from my own research I was doing, but it was great to hear it in person. I read a lot of books. I really loved the Mayo Clinic Guide to Pregnancy. I thought, that's interesting that you said, huh?
Yeah, I just thought it's one that I haven't read yet. Yeah.
It's very similar to your course and your podcast. It's sort of the facts without too much, opinion or dogma added in. And I thought it was great information. And then because I was interested in avoiding epidural, I looked at Birthing from Within. I looked at the hypnobirthing book. And then I also listened to a lot of birth-related podcasts, including Birth Stories, including your podcast.
Okay. All right. So you did what I think is fairly typical for a lot of first-time moms in particular, is that you gather information from lots of different sources. So you can hear different opinions and thoughts and kind of take what resonates with you.
Yeah. I'd say that's exactly right.
Yeah. Let's talk about something most pregnant women aren't getting enough of, omega-3 DHA. The recommendation is over 200 milligrams a day, but less than 5% of pregnant women in the U.S. meet that. That's one of the reasons I love Ritual's Essential Prenatal. It has 350 milligrams of vegan DHA plus other key nutrients like methylated folate and choline to support baby's neural tube development. As an OBGYN, I appreciate that Ritual goes beyond the basics. The formula is science-backed, third-party tested for heavy metals and microbes, and every ingredient is traceable. And the delayed release design, it's gentle on the stomach, something that really matters, especially if there's trouble with nausea during pregnancy. You deserve to know exactly what you're putting into your body, especially when it comes to prenatal multivitamins. And with Ritual's dedication to traceable science and sourcing, you always will. See for yourself with 25% off your first month at ritual.com/Dr. Nicole. Start Ritual or add Essential Prenatal to your subscription today. That's ritual.com/Dr. Nicole for 25% off your first month. So how did you come to choose my course?
I heard you interviewed on another podcast I'd been listening to. So that's how I found your podcast in the first place.
Okay, let me guess, either Birth Queens or Evidence-Based Birth? Or...
It was Birth Queens. Yeah. And then I guess through them and through you, then I found Evidence-Based Birth and also listened to that podcast. So then I went and listened back over your back catalog. And I've really appreciated how your approach to explaining things, that you're an obstetrician, so have the firsthand clinical knowledge and are able to just summarize what seems daunting and scary to those of us who are the patient and summarize it and make it just sound like it makes sense.
Well, thank you, because that is certainly what I aim to do, because I know that this can certainly feel sort of overwhelming. And guys, I don't, this isn't intended to be like a commercial for my course or anything like that, I promise. And I'm actually going to ask Miranda to give some feedback if there's some things she would have liked to see that were, differently. But I do want to give a sense so people can understand sort of firsthand what it's like to go through it. I think I certainly have my perspective as an OBGYN, but it's helpful to hear all kinds of different materials in order to get ready for birth. So how did you approach going through the course? Did you kind of binge through it, or did you do a little bit at a time?
Definitely binged through it. I think I had signed up for the course and then not really done the modules. And then in my 8th month, I think, of pregnancy, I did the whole course over, I think, 2 weekends.
Okay. All right. I'm curious for the birth wishes piece. Did you decide to make a birth plan and talk about it with your doctor at all?
So yes, I did. We also hired a birth doula who was present at our birth with us. And part of her service was she helped us make a visual birth plan, which I think you said you recommended, where there's those images.
Yep.
Because so much of it aligned with the standard of care practices, my doctor knew that I wanted to avoid an epidural, knew that it was important to me to have a vaginal delivery, but the rest of the birth plan, since it fit into their standard of care, I think actually, in hindsight, the birth plan paper, I don't remember it ever actually showing up at our actual delivery and birth.
And, honestly, I think ideally that would be the way that it goes, because you already know ahead of time that you're fairly confident that the person and the team that you're working with is going to support what you want. It doesn't have to be any sort of, big discussion or fight or anything like that.
Exactly. I think that worked out really well.
Okay.
But having I did the separate session that you offer, the birth plan preparation. And I really like that it broke it down into the top things that you should think of. When you Google birth plan, it gets a bit overwhelming with all the different information that's out there.
Right. So did your partner go through the course too, or did he only do the in-person class with you?
He only did the in-person. The plan, when I had planned for him to do it with me, but best laid plans. But I did share the information that I thought was relevant to our situation, I shared with him.
Got it. Okay. So let's talk about what was your, let's talk about what were things that you liked about the course and maybe things that you wish you would have liked to see included.
So because I was advanced maternal age, I knew that the plan would be, it was the strong recommendation of my doctor to have a labor induction at 40 weeks. And so I had paid a lot, I was very worried about having induced labor, worried about it affecting my two goals of vaginal delivery and avoiding epidural. And so I really focused on your sections on labor induction. It was really comforting to learn about how long labor induction can last, that it's normal for it to be longer than 24 hours and it's not stalled labor, the criteria that the information you gave on what defines stalled labor. So I really enjoyed those. I really liked your section about the first few sections when you talk about your mental state and how mental state plays such an enormous role in your birth experience. And I very much found that to be true.
Yeah, that's something that I honestly, sad to say, didn't really appreciate until I've been in practice for a bit more. But it is so important to have to start the game, so to speak, with the right mindset.
And I'll say my doctor said to me, somewhere around 36 or 37 weeks, he said, Miranda, I know you're going to have a great birth experience because you are so calm and knowledgeable and you know what you want, but you are able to, go with the punches or whatever he said.
Yeah.
And that was very comforting. And I think having done all this education helped me get to that place that I felt pretty calm about everything.
Yeah. And you sound calm. Even now you sound calm.
Yeah, well, there's a part of the story that stopped being calm for sure.
I guess we'll get to that point. And then I did, was there anything that you would have liked to see more of in the course or included?
I don't think so. I think, that's the benefit of sort of using different resources, that everyone has a different focus. And I think I think it was a great amount of total time. There are other courses like hypnobirthing or something like that have much more focus on non-medication pain management, but that wasn't what I was looking for in your course. And you certainly you had a whole long section talking about avoiding epidural.
Yeah. So enough about my course. Let's talk about your birth. So what was your birth like?
Well, so I did all this preparation and I had my idea of what I wanted it to be. And I paid attention to everyone saying that you can't plan your birth. And thank goodness I did, because you can't plan your birth. And it really didn't go, badly, but nothing went sort of the way I had pictured it to. So I did have labor induction performed. The hospital I delivered at only uses the Foley catheter for cervical ripening. They don't use Cervidil. And so the way it worked is I went in the evening, had an IV placed, started on Pitocin, had the Foley catheter placed, and then just waited overnight. Waiting overnight, everyone says that's a great time to take a nap. I definitely found that with all the monitoring strapped around you that slips out of place so quickly, and the nurses having to come in and adjust your monitors, it really meant that I didn't sleep very much overnight. We had planned with our birth doula that she would meet us at the hospital the following morning when things would really sort of start kicking into gear. And that's definitely what happened overnight. The contractions that the Pitocin was causing were very manageable. And then by morning time is when it really started to be much less comfortable. And so having the birth doula there with us was great. She did a great job of sort of coaching me through it. It turned out that I very much didn't want to be touched in any way. So all of our plan for possible massage and counter pressure kind of didn't work out because of how I felt.
That's very interesting. It was something that I think a lot of times you see in like Facebook posts, Instagram posts, like, oh, you need massage. Oh, you need this. Oh, you need that.
Yeah.
But honest to goodness, until you are in it, you really don't know what you'll need.
Right. You don't know. She had brought aromatherapy and had a little towel next to me, and it was the worst thing possible that could have happened to me. And I had to get that aromatherapy out of there immediately.
Right.
So you don't know. You really don't know until you're there.
Right. Right.
So everything was progressing well. We were doing well through the day. And so this was, 18 hours or so of being in labor or being in the medically induced labor. And the plan was to check me. I was going to have a cervical check again at some point that evening. And so I had this time in my mind. And, as the day was progressing, as the contractions were getting harder and harder, I kept thinking about this time and telling myself, well, as long as everything's looking good, as long as you're well dilated, you can keep going. It's going to be fine. So that check came. And at that point, I was, if I remember correctly, I was very well effaced at 80 or 90%, but I wasn't very dilated. I was at 5 or 6 centimeters.
Okay.
And so that's when the doubts in my mind set in. So I spent the next 2 hours thinking, I can't do another 5 centimeters of this. This is only the beginning of active labor, thinking a lot about having the epidural placed. And so we chose as a team, but mostly my decision, to have the epidural placed. And both my husband and the doula were, of course, very supportive of that. And that went really well. I've had herniated disc problems in the past and had epidural steroid injections that were a very bad experience. And so that was also part of my concern.
Sure.
But this was, nothing like having those injections. It was it was a totally painless experience. But I had an epidural that then only worked on one side of, only one side of my body was being affected. After an hour or so, the left side wore off. So twice I was given boluses of additional medication. And one of those times it caused my blood pressure to drop significantly. And so, having the epidural placed sort of started this cascade of, and not the true cascade of interventions, but it just started things being much more complicated and having more problems. I will say, the epidural is just incredibly effective when it's working on both sides. And I had gone from being silent and really just closed into myself to chatting with my doula about her pets. It's amazing the difference that happens.
Yes, it is. It is an effective, very effective when it works, for sure. But I can't, what is that? I've had women have that lopsided feeling. I can't imagine what that feels like.
Well, I just started feeling the contraction pain mildly, but it was very much only on the left side. It was only on the left side. And then over the course of half an hour or so, it just got more and more intense to the point that the contractions were as intense as they had been.
Got it. But just on the one side.
But just on the one side. So it just really feels like cramps or contractions on the left side. And, once the epidural was placed, they had turned up the Pitocin. And it was mentally very discouraging because it had been a little bit of a hard decision to decide. I definitely didn't feel like I had failed in any way, but it was a big decision to go forwards and a big procedure. And then to think, oh man, I did all that and it's not even working. But again, they were able to make it work again. Having my blood pressure drop, though, was a really unpleasant experience. You just feel so nauseous and weak and terrible when that happens.
Yeah. Did it make your baby's heart rate drop also?
No, she did great through the whole thing. I got a whole lot of fluids bolus and they had blood pressure medication given. One of the things that was important to us to have was to have calm lighting. And we had brought in, I think this was your suggestion. Oh, you suggested Christmas lights. We brought in LED candles.
Oh, nice.
And it was really nice having the calm lighting. But whenever, when the epidural was placed, when they were coming in to treat my low blood pressure, they had to turn on all the bright fluorescent overhead lights. And it just really, really changed the feel of being in there.
Yeah, I hate those things. I think they're so
terrible.
They are so awful. I mean, they're just so bright and sterile.
They're terrible.
Yes.
The nurses and the OBs, they were like, oh, it's so nice in here with your candles. But the anesthesia team were not as impressed.
All right. So you got your epidural around 6 centimeters or so. So what happened from there once you got comfortable?
So that had been 5 or 6 p.m. I think that maybe the epidural went in at 7. Around midnight, they checked me again. And at that point, I was 100% effaced in 9 centimeters or 8 or 9 centimeters.
Okay.
And so they had sort of planned that we would start pushing in 1 to 2 hours. It's a busy hospital. There's a lot of women delivering there at any given time. So of course the OBs are doing their best. So I think that 1 or 2 hours turned into 3 hours. So I think around at some point overnight is when we all started pushing together. And that's where it got really hard. Certainly the epidural, what I hadn't realized is it doesn't, when it comes to pushing, it doesn't, you actually start feeling pain again. Well, at least I started feeling pain again. Definitely, that's when I found out that pushing is the best way to handle that pain and to get you through it. It had been my goal to be able to move around, and of course I couldn't. I had to stay in the bed, but it was great having my husband and the doula there to support. My poor husband, he tried counting the pushing for me, and I couldn't tolerate any kind of instructions coming from him. It was much better coming from the medical staff. He was great at supplying water.
Yeah.
And I could tell, it definitely was not going quickly. The support staff and the medical staff were making a point of not telling us how much time had passed. But it definitely felt like it was going for a long time. And I was just getting more and more and more exhausted, and to the point that I really, really felt like I didn't have anything left. The hospital I deliver at actually still use forceps to deliver. They're one of the, I understand not very many hospitals still do that.
No, the Northeast uses a lot more. There are more doctors who are skilled with using forceps in the Northeast.
Oh,
for sure.
Interesting.
Mm-hmm.
That's really interesting.
Yeah.
So my obstetrician, who was not the doctor I did prenatal care with, but I had a few appointments with her. So it was someone I had met before, and I had known going into it that would be the situation. She, at some point, she said, Miranda, I think we should think about either vacuum assisted or forceps delivery. And I was very much relieved, because I was starting to feel like I couldn't see a way out of the situation. My husband was terrified of this. He didn't know much about forceps and thought that it was very dangerous for the baby. But luckily, he actually didn't say anything at the time. But so once the decision was made for it to be a forceps delivery, things changed really fast and got really scary. My eyes had been closed through most of this pushing phase. And at one point I opened my eyes, and it had gone from 4 or 5 people in the room to 15 or so. There was,
oh my God.
two new, there was a resident OB and an attending OB who had shown up. And then there was the pediatric team for the baby. And even with the forceps, it still took a couple of rounds of pushing to get her out. And, everything suddenly felt really, really scary to me. Because she came out with forceps, I guess this is their standard, is that we were not able to do delayed cord clamping or direct skin to skin, because she was taken right to the warmer to be assessed by the peds team. She was a little champion, and she never had any problems whatsoever. And very soon after being delivered, our doula helped my husband do direct skin to skin contact. And meanwhile, I had another blood pressure drop, and they were worried about how much I was bleeding. And so where I was, things felt very scary, and I felt really sick.
Oh my goodness.
And so then they told us how long it had been, and we'd actually had been pushing for 3.5 hours. So that's, I guess, why I was so exhausted by the end.
Yeah.
So it turned out to be, everyone tells you, everyone knows that childbirth and delivery is a really hard experience to go through. But I found that it was so much harder than I had anticipated it was going to be, and scarier. I never felt in danger, and I felt like I had great care and great support, but it was a lot harder than I thought it was going to be.
Right. Do you feel like your doula and the medical staff were able to help you manage the fear at all, or was it just so much?
I think they definitely, they absolutely were. Having the birth doula was such a good decision that we made. We both, my husband and I both, feel like how could we have done that without having her? The labor and delivery nurses were in with us really frequently, but they have other patients, and our doula was with us permanently and was able to tell us, I've seen this before. This is normal. This is how, this is normal, the way everything's progressing. And that was really reassuring.
And the nurse changed shit. I mean, you probably have you had a couple nurses, or 2 or 3 nurses probably.
Well, we did, but we had the nurse we had the first night came back the second night. So she was with us for delivery, and we had thought that nurse was really wonderful. So that was nice to have that continuity.
Okay. That's good. That's good. And how did you find your doula?
I found her through Doula Match website.
Yep. Okay. Good. So looking back, how do you feel about your birth experience?
So looking back, I feel really great. I feel like it was a really hard experience that we got through together, and that I was able to be tough and get through. I feel like it was an enormous achievement. It makes me really emotional. This is the first time I've talked about it without bursting into tears.
Right.
But I guess that's to be expected. Nothing went badly, and we have the vaginal delivery we'd hoped for, but it's a really big deal delivering a baby.
It is a big deal. And like you said, it can be unpredictable. And even though overall, you had a vaginal delivery, there's still some elements that can sometimes feel hard, or maybe even a little bit traumatic to some degree. Yeah.
And I think if our baby had been having any problems during it, if she had any changes in her heart rate, we would have been sent straight for C-section. The fact that she was doing so well is the reason we had the outcome that we did. But it's also amazing how quickly the difficulty and the pain fade from your memory. Within a few days, it really felt like a distant memory. And at this point, this was almost 11 weeks ago, and it feels like a lifetime ago.
Right. So when you say before you would talk about it and you would kind of get teary about it, what do you think made you feel teary?
I think it's an overwhelming experience, but I also felt tremendously proud that we had gotten through it, or that I had gotten through it. And, ending up with your baby is an incredibly emotional experience. And you have all these postpartum hormones making you cry about everything. So I think the arrival of your baby just makes you very emotional.
Yeah. And then do you feel like your OB, and I'm sure your doula probably checked in on you after birth, but did you have like a 6-week visit, or did you see the doctor before then? Like, what was your postpartum, that immediate first couple months support like?
So I had seen my primary OB, who I'd done the prenatal care with several times in the hospital before we were discharged. So that was nice to be checked on by him frequently. When the decision was made to use the forceps, they had to do an episiotomy, which of course was another thing that I was hoping to avoid. And this hospital that I delivered at, they're actually trying making lateral incisions, so at the side of the vulva.
They're a little less painful, maybe.
Yeah, maybe. But what happened to me is a few days after going home from the hospital, it got really painful, and I went back in and it had become infected. And so I had several extra visits to follow up due to that.
Okay. All right. And that can be a process. And again, not something that you would necessarily expect.
No. I guess, of course, that can happen, but you don't really plan for that. And it became painful over the weekend when they only have an emergency fit. Yeah, of course.
Oh, well, hopefully that wasn't too involved to get.
It was, no, I just needed a course of antibiotics, and, the healing went much more slowly than I expected, but I guess that's normal. When you're breastfeeding and it changes your hormones and you just don't heal the same way.
Right. Do you feel like anybody ever helped you address some of the emotional aspects, or asked about some of the emotional aspects afterwards?
They definitely did. It didn't come up at those extra visits, but at the 6-week visit, I filled out the survey, and my doctor asked to make sure I was feeling okay. I definitely had some pretty significant postpartum anxiety. I guess that was also a surprise of just how intense I was worried about her and whether or not we were doing the right things and if she was okay. And it was something that I felt comfortable talking openly about. I talked to my husband about it. I was having some intrusive thoughts about her being hurt or injured. And I would tell him about them, and it made me feel a lot better. I talked to my mom about it. So it was something that I never felt like I needed to seek care, but it definitely got to the point that it was affecting my ability to enjoy her. But after about 3 weeks, it really faded off, and I stopped feeling that overwhelming anxiety and just felt pretty normal level of worrying about her.
Right. And that is totally normal. And I don't think we emphasize enough like how normal that is. I was an anxious basket case after my first one because she was a preemie and I was worried she was going to get sick. I remember driving her in the middle of a snowstorm to the doctor because she threw up like a quarter size amount and it freaked me out. So so I don't think we do a good enough job of. So I hope you understand that like that was totally normal.
I actually disagree. I think at least the resources I was using to learn about childbirth and delivery were talking a lot about postpartum depression and postpartum anxiety. So I knew that the majority of women suffer from postpartum anxiety and that, I sort of had in my mind criteria for when I was going to say, I think I need to go talk to someone.
Well, that's amazing. Yeah. Yes. Well, I'm very glad to hear that.
Yeah. One of my closest friends is a therapist. And so I'd reach out to her and say, does this sound okay? Do you think I should go talk to someone?
Right.
Of course, her answer was always, yes, you should just go talk to someone.
Of course. So looking back, is there anything that you would change or do differently?
No, there really isn't. I hadn't wanted to have a induced labor, and I think probably things would have gone very differently if I'd had a labor start naturally. But my doctor had talked to me a lot about, I think is it the ARRIVE study, the different research for it. And when the time came, it felt like it was the right choice to make. There isn't really anything that I would do differently.
Okay. And I hope, like with the forceps, like it's just helping. You're still like do the vast majority of the work. It just adds a little bit of extra oomph to it. Yeah. So you still have to push at the end, even with forceps. So I can imagine how exhausted you were after 3.5 hours of pushing.
I was hoping that I was off the hook. I didn't have to do any more pushing.
It's like
nope.
Nope.
But I mean, thank goodness for medical interventions that make all the difference.
Right. Yeah, for sure. Finding something to wear during pregnancy shouldn't feel frustrating. And with Armoire, it's actually fun. Armoire is a clothing rental membership that gives you access to high quality, beautiful pieces that fit your changing body and your style. You take a quick 5-minute style quiz, pick what you love, and fresh styles show up at your door in as little as 2 days. I recently tried Armoire and y'all, I loved the dress they sent. It was flowy, flattering, and it had pockets. I felt so good wearing it. You know that feeling when something just fits right? That's what Armoire delivers. And for you, Armoire is the answer to feeling cute and confident in maternity clothes without spending a fortune. No more clutter, no more wasting money on clothes that won't fit in a month. Just stylish, feel-good options on your terms. Right now, my listeners can give Armoire a try and get up to 50% off their first month. That's up to $125 off. Just visit armoire.style/Dr. Nicole. That's armoire.style, ARMOIRE.style/Dr. Nicole to get up to 50% off your first month and never worry about what to wear again. Try Armoire today. So looking back afterwards, I will ask, do you feel like going through the materials and my course was helpful to you? And what would you say to someone who's thinking about it?
I definitely felt that your course specifically was really helpful. And we actually had printed off your hospital tip sheet to bring with us. You know, when you have when an intervention is being suggested, here are the things to consider. Of course, when it came time to the forceps intervention being suggested, my response was, yes, please, just hurry up and do it.
Get this baby out of my body right now. Out. Whatever.
But I really felt having that sort of hospital-based perspective, obstetrician-based perspective, I'm really pleased that I did your course. I think it made a big difference to me.
Oh, I'm glad. That makes me happy to hear. I appreciate that. And guys, I swear I didn't pay Miranda or ask her. I wanted her honest feedback.
and the price that you've set it at is a very reasonable price point. I felt like, there's so many, our in-person course had been, I think, $500 or something like that. And so it gets overwhelming if you're doing all this education. The cost can add up very significantly.
Yeah, for sure. So let's end with, if you had to share your one favorite piece of advice to share to women as they get ready for their birth, what would that advice be?
I would say hire a birth doula. We also had a postpartum doula come. It was a different woman, and the postpartum doula was really instrumental in helping us get breastfeeding going.
Nice.
And so both women, I feel so indebted to. They made such a difference in my experience.
Yeah. How long did you have the postpartum doula for?
We had her for 4 to 5 hour sessions.
Okay.
And we spaced them out over 2 weeks. And then we actually had her back for an additional belly binding ritual that she was trained in and did with me. That was a really sort of like a nice little spa session for me.
Oh, that is nice.
Yeah, it was really nice doing that extra session as kind of honoring what I had been through.
Yeah.
So both of those women were fantastic.
Yeah. It's one of the things I say, like, if you're thinking about things like baby shower gifts, ask for a gift card or a contribution to help with a doula, because that will go so much longer than 12 packs of onesies.
Exactly. And that's the other thing. Everyone's so focused on what childbirth and delivery is going to be like. And it turns out that taking care of a newborn ends up being a much bigger deal and way more significant and much longer time period. And so I think you mentioned this on your podcast. I heard it mentioned, but I was just so focused on labor and delivery, and that stuff, for the most part, you really can trust the hospital to take care of you and to do. I could have done less labor and delivery or childbirth education and maybe a little bit more newborn education.
Right. You are in a fortunate situation. Unfortunately, I get stories, emails, and social media messages every day of people who are in circumstances where they are not quite so supported. So
yeah, absolutely. Absolutely.
Yeah. So, all right. Well, thank you so much, Miranda, for being here and sharing your story. I really, really appreciate it, with a brand new baby at that.
Well, thank you for asking me to. It really was a pleasure.
Yeah. And I always ask is, if you're open, where can women connect with you, or are you kind of like not on social media sort of thing?
I have a Facebook. I'm in the Facebook group for both the class and your podcast.
Oh, perfect. Okay.
I'm probably the only Miranda in there. But I don't really use Instagram or other social media.
Yeah. Okay, perfect. Well, then if folks have some questions or want to ask about Miranda's experience, then you can connect with her in either one of the groups. All right. Well, thanks so much, Miranda. I really appreciate your time.
Oh, you're so welcome.
Okay. All right. Take care.
Take care.
All right. Now, wasn't that a great interview? I just really appreciate how honest Miranda was about her experience and how she was able to find joy in what was a challenging situation, even though she ended up with a vaginal birth like she wanted, and how it was a little bit rocky along the process. So again, thank you, Miranda, for coming on. Now, after I have a guest on the show, I do something called Nicole's Notes, where I talk about my top 3 or 4 takeaways from the discussion. And here are Nicole's notes from my discussion with Miranda. All right, number 1. I was excited to hear that she said delayed cord clamping and immediate skin-to-skin contact were standard of care at the hospital where she delivered. I know that there are a lot of issues with the way we provide care for pregnant women in this country, but there are some glimmers of hope that we are making progress. We still have a ways to go, but definitely there's progress being made. So I was glad to hear that at the hospital where she was, those things were standard, as they should be, of course. Number 2, Miranda's point about you won't know what you want for your birth until you're in it. This is something that I like to remind women of all the time. You may hear stories or see articles that say, you got to have massage, or you have to deliver in a certain position, or you need to do this, you need to do that during your birth. And the truth is, you really will not know what you want until you get there. She thought she would like massage and she hated anybody touching her. She thought she may like aromatherapy but couldn't stand the smell of it. So really what you need to do is just learn about your options and be open to changing and trying new things. That flexibility is key. You don't want to go into your birth with this rigid sort of way of how you think you should do things or what's going to work or not work. Be open to know the possibilities, try new things, take what works and move on from what doesn't. All right. The third thing is Miranda talked about how she had postpartum anxiety. And I just bring this up. I think I talked about this in the last episode as well, or maybe the last 2 episodes actually. Anyway, how women don't necessarily just have postpartum depression. Some of the issues that can sometimes show up as anxiety, where you're really, really worried or anxious about things despite things going well. So just be mindful for that and be willing to or open to asking for help, or ask for help if you experience that. And then the final thing that I took away that Miranda talked about, 2 things that are really important that I want you to keep in mind for your own birth. Number 1, she talked about how helpful her doula was. And I can't say this enough. A good doula can be really, really helpful during your birth. Your doula is there the whole time, whereas your nurse may be in and out of the room. She's going to be the second person who's there the most. And then your doctor is not there very frequently actually during your birth. So having a good supportive doula as that constant sort of presence can make a big difference, and especially one who has some experience. And then the other thing is the importance of your mindset for your birth. You really need to do some work to get yourself in the right mindset before you go into your birth. That mindset piece makes a big difference. All right, so that is it for this episode of the podcast. Be sure to subscribe to the podcast in Apple Podcast or wherever you listen to your podcast, Spotify, Stitcher, Google Play. And if you feel so inclined, I would love it if you left a review in iTunes. Always keep it honest, of course. Those review in iTunes or Apple Podcast, I keep saying iTunes, but it's Apple Podcast. Those reviews are important for helping the show grow, and they help other women find my show. So I really appreciate you taking the time to do so. And then most importantly, I just love reading what you say, and I love connecting with folks who listen. And I also give shout outs to folks on the show who leave reviews. So leave me a review in Apple Podcast if you're so inclined. And then the last thing I'll say is that I know that there are a lot of resources that are available to help women get ready for pregnancy and birth, and you ultimately have to find what works for you. But when you're thinking about where to most effectively spend your money and spend your time, especially considering that you probably need to spend some time not just getting ready for pregnancy and birth, but also the postpartum period. Miranda mentioned how she wished maybe she spent a little less time on all of the different things for birth and spent a little more time getting ready for the postpartum period. When you think about where to spend your time, where to spend your money, and what's going to be an effective investment for you, the birth preparation course is really an exceptional value for everything you get. I have put a ton of work into this course just to really keep it as tight and concise and information packed as possible. So it's 8 hours of content. It covers everything from how to get in the right mindset for your birth to what labor's like, how to manage pain, how to push, how to avoid tears, what happens with induction, the immediate postpartum period, and then even some less common things that aren't typically covered in other classes, like how to have the right support team to make sure you have the right people around you, how to safely approach placenta encapsulation, the risk and the benefits of circumcision, and so much more. You also get lifetime access to the birth preparation course, so you enroll once and you have it for all of your future pregnancies. So go to ncrcoaching.com/discount to check out the course and grab a big discount on it. There's a 30-day money-back guarantee. So if you're not happy with it, just shoot me an email within 30 days and you'll get your money back, no questions asked. Or if you want to get a more up close and personal feel for what the course may be like, take my free class on how to make a birth plan that works. The content of that class is taken in part from the birth preparation course. So that free class is a great way to sort of get a feel for my style and the type of information, just kind of check it out and do a test drive, so to speak. So you can go through the free class on how to make a birth plan that works. And that's also packed full of information too. Go to ncrcoaching.com/register to register for that. Okay, so next week on the podcast, I am talking about immunizations and pregnancy. This is an important episode, something that you don't want to miss. So come on back next week. And until then, I wish you a healthy and happy pregnancy and birth. Today's episode is brought to you by Women's Wellness Coaching by Dr. Nicole Calloway Rankins. Head to ncrcoaching.com to check out my free 1-hour mini course on how to make your birth plan, as well as my comprehensive online childbirth education class, the Birth Preparation Course. With over 8 hours of content and a private course community, the Birth Preparation Course will leave you knowledgeable, prepared, confident, and empowered going into your birth. Head to ncrcoaching.com to learn more.